Right. Good morning, everybody. My name is Dr. Strudel, and I'm with MNGI Digestive Health. Those are my disclosures, and those are disclosures of the program. Today I wanted to touch base on health maintenance in inflammatory bowel disease, particularly in children, since I'm a pediatric gastroenterologist. And health maintenance is defined as a guiding principle of healthcare that emphasizes health promotion and disease prevention rather than management of symptoms and illnesses. Inflammatory bowel disease is a chronic condition that has periods of remission where a patient feels well and periods of flares when patient is not feeling well. And the goal of treatment and the goal of health maintenance is to make these periods of remission as long as possible and make these periods of flares as short as possible and as mild as possible, as well as prevent potential complications related not only to the disease itself, but medications that we use and complications arising otherwise. Health maintenance has many different components. It includes nutrition and cancer screening, as well as development and growth in children. We need to take certain steps prior to initiating any immunosuppressive therapy, as well as monitoring medications as we go. It includes prevention of infections and screening for potential infections, as well as psychosocial health, bone health, as well as monitoring certain medications that we use for treatment of inflammatory bowel disease. Growth failure is very common in children in general who have inflammatory bowel disease, and many children suffer from poor weight gain or weight loss as the disease progresses. We sometimes observe delayed puberty in people with inflammatory bowel disease. In fact, over 40% of patients who have Crohn's disease may be underweight and experience growth failure, and it happens less commonly with ulcerative colitis comparing to Crohn's disease. 1 in 5 children with inflammatory bowel disease, mostly with Crohn's disease, may not achieve expected adult height. And we have to be hypervigilant to monitor these parameters and make sure that we can address them and prevent them as much as we can. We typically do it by following growth chart closely, monitoring growth rate, as well as weight gain and BMI during each visit, as well as asking for information from the primary care providers to provide us. When we see children, we try to avoid steroids as much as possible, such as prednisone, because those are known to cause stunting and decreased growth in children. Some patients may benefit from referral to an endocrinologist when we think that growth hormone therapy may be necessary, or when we think that poor growth rate is related to some endocrinologic condition that also may happen with inflammatory bowel disease. We also screen for micronutrients such as vitamin D and calcium and iron, folic acid, B12, and zinc in many patients with inflammatory bowel disease, because these may have significant effect on children's health and growth. Some patients, in particular those on chronic steroids, may benefit from DEXA scans, or those with recurrent fractures, to monitor for bone health and bone density. And while most of the patients would not be put on medications such as bisphosphonates that are used in adults, some may benefit from this medication, and we will consult endocrinology when it's necessary. It's really critical to bring all immunizations to be up to date in children with inflammatory bowel disease, because this is one of the ways for us to prevent any possible infections that can be easily prevented by immunizations. You can download this application from CDC to see if your child is up to date in immunizations, compare it with the records you have, and ask your pediatrician or your GI doctor whether additional vaccination is necessary. Some of these vaccinations are standard of care for pediatrics. Some of them, like extended pneumococcal vaccine PPSV 23, is one that we typically suggest for patients who are on immunosuppressive medications, and otherwise they're used in older adults or people with chronic conditions in adult world. We definitely recommend people to be up to date on hepatitis A and B vaccines, as well as pneumococcal vaccines, series HPV, half annual influenza, and COVID vaccines. And I just want you to be aware, if you haven't been already, that the new booster for Omicron virus has been approved by both FDA and CDC and should be available very shortly for administration, as long as the person had vaccination previously, and it's approved from age 12 and up. It's debatable whether we should measure titers or antibody levels that suggest that patient is has a protective antibodies against certain diseases that vaccinations have been given. I typically do recommend, we know that people with inflammatory bowel disease may not be as good as developing protective antibodies against many of these viruses, and typically I do recommend my patients to be screened for antibodies, because if they have low antibody level, we can give them boosters or additional injections of immunizations to bring their immune system up to speed to help them prevent these infections. Those people who are on immunosuppressive medications should avoid having any live vaccines, and standard vaccinations that are live would be MMR, which is measles, mumps, rubella, varicella, or chickenpox, as well as flu mist, which is intranasal spray administered flu vaccines. The flu shots are completely fine. The special attention should be paid for international travel. We should not only be ready for looking into food safety and water safety, but also access to medical care and medications. What will happen if Humira that you put in, your frizz pack is going to, not work, and by the time you arrive, you notice that the ice has melted. Can you get a Humira at the destination of travel? How you get it? What happens if you have a flare? Where the hospital in areas? How to deal with emergencies? There are many locations where there are illnesses that can be transmitted by insects and mosquitoes, so using bug spray or nets when you are in these areas is important. Some patients may be at risk for clotting, increased clotting, in particular with long travel by air. So this discussion should happen whether or not patients should wear, compressed stockings or things of that kind should be discussed before travel. Some international travel may require vaccinations to prevent illnesses that are very unlikely to happen here, but are more likely to happen at destination. And while using inactivated vaccines in this list is completely fine for any patient, including those who are on immunosuppressive medication, live vaccines such as yellow fever are contraindicated, and that particular vaccine is required, as far as I know, to travel to Brazil. So this is one of the destinations that is problematic for patients who are on immunosuppressive medications. Some areas would require chemoprophylaxis for malaria, which are medications that you take before you go and as you go there to prevent this disease if you get exposed through a mosquito bite. And you probably should discuss with your physician, primary care doctor, as well as GI doctor, as to whether medications you're on may somehow have interactions with medications you're taking for malaria prophylaxis, and how to proceed. Traveler's diarrhea, which is diarrheal illness that happens when we're exposed to different kinds of regular bugs that we have here, but our immune system is not used to, is fairly common. The problem with when you have inflammatory bowel disease is that you may potentially have a flare of inflammatory bowel disease when it's triggered by traveler's diarrhea. So I typically tend to send my patients in these destinations with some antibiotics like ciprofloxacin that they can take if they develop diarrhea on location, because it's more dangerous than the healthy person who would have a diarrhea but which would resolve in a few days. It's really critical, and the whole point of my topic, the main point of my topic that I want you to take home, is how important it is to have a good communication with your GI provider, even when you're not in the office, because some patients we see only once a year, once every 6 months, particularly those who are doing really well. But we want to hear from you if you have questions, if you have concerns, if you have any other symptoms that may not be necessarily seem to be related to inflammatory bowel disease. So if you have any symptoms, one of the things we should think about, could it be some sort of infection? Could it be opportunistic infection, which are kind of infections that develop in people who are immunosuppressed, but wouldn't develop in people who are healthy otherwise and have normal immune system. One of the common ones that we see with inflammatory bowel disease will be tuberculosis and histoplasmosis. So if you have any symptoms at all, any concerns, please let us know, because the earlier we'll find that something is wrong, the quicker we can treat it and the better we'll be at preventing any potential complications. Prior to starting biologic therapies, we should test patient for tuberculosis, for latent tuberculosis, so tuberculosis that doesn't show any symptoms but happen in person has been exposed to tuberculosis previously, and the TB bacteria lives silently in the body and may cause infection one's immune system is suppressed with medication or otherwise. So we typically would use quantiferon nowadays. We rarely use MAN2, which is the injection, intradermal injection that has been used in the past to screen if a person was exposed to TB in the past. And if we find that it's positive, the person would be treated before we start on biologic medication. Which is the rare thing nowadays that we would start thiopurines, such as 6-MP or azathioprine. It does happen sometimes. And we typically would test for special enzyme that helps the body digest this medication and determine that the level is adequate, because it will help us to determine change in dose that may be necessary in those who have low level of enzyme, or if you have no level of activity, we may suggest a different medication altogether. All the patients with who we start on biologics are typically screened for hepatitis B and hepatitis C as well. We know that patients who have any chronic inflammation in the body may be at risk for developing malignancies or cancer. And this is certainly true for people who have been having inflammatory bowel disease for a long time. This is something that typically correlates with extent of the disease and severity of the disease. So that person who has been in prolonged remission over a long period of time is much less likely to be at higher risk than general population to develop cancer, as opposed to people who have common flares and have extensive involvement with disease inflammation. So people who have more than a third of their colon involved and who had disease for over 8 years typically would recommend the surveillance colonoscopy every 1 or 3 years, depending on the family factors and risks in what we found during previous endoscopy. There is a condition called primary sclerosing cholangitis, which is a liver disease that causes scarring and inflammation of the bile ducts in the liver. And if a person has this particular condition, the risk for colorectal cancer increases, and typically recommendation is not only to screen yearly with surveillance colonoscopy, but also screen for hepatobiliary cancer that may develop as well. Cervical cancer has been seen, and it's certainly increased in people who are taking immunosuppressive medications. And in addition to taking HPV at recommended age before 15, we typically would recommend annual screening with pap smears every 2 years once a patient turns 21. And while we are pediatric gastroenterologists, many of us do see college-age students. Sometimes kids are not ready to go to adults. Sometimes they want to stay with a pediatric gastroenterologist for a little longer. So we definitely see this kind of people in between the age groups. Skin cancer may be associated with medications that we're giving patients to help them maintain remission for inflammatory bowel disease. Thiopurine, such as 6-MP or azathioprine, has been associated with non-melanoma skin cell cancer. And biologics like Remicade or Humira have been associated with melanoma skin cell cancer. So we typically would suggest a full skin exam through your dermatologist, not primary care doctor, but dermatologist early on. And certainly if you have, and do it yearly. And if you do find some unusual lesion on your body or on the body of your child, please bring it to your dermatologist to review it early. The risk is low, but it does exist, and seeing your dermatologist early will certainly prevent this kind of complications. In addition to that, just be aware that in particular melanoma skin cell cancers have been associated with sun exposure, so wearing SPF clothing, using sunscreen or sunblock, and seeking shade when possible is certainly a good way to prevent this from happening. Again, we want you to tell us any symptoms or any concerns. It's pretty obvious to call your GI doctor when your child or yourself have diarrhea or blood in the stool or stomach pain. It's less common to associate other symptoms that may be associated with inflammatory bowel disease as well with IBD. So if somebody has canker sores, it may be potentially a sign of flare for inflammatory bowel disease. If you have certain rash called erythema nodosum, which is big red bumps that are tender to touch on your shins primarily, but it can happen anywhere in the body. It can be associated with flare of IBD, or it may be associated with certain medications that we're giving you. It can also be associated with potential infectious complications such as tuberculosis, for example. Less common rash called pyoderma gangrenosum are ulcers that typically develop on the lower extremities and buttocks, and this is something that does happen with inflammatory bowel disease, and there are ways to treat it and adjust it. Adjust treatment, and certainly something that if you have it, let us know and we can look into this. Psoriasis is a skin rash, autoimmune skin disease that has been seen in patients who have been exposed to certain biologics. It may happen independently of biologics, or it can happen when patient has been exposed to infliximab, which is Remicade, or Humira, which is adalimumab. And depending on extent and severity of this rash, sometimes we can treat it topically with medications and topical medication, and sometimes we need to switch medications completely to a different group of medications, such as Stelara, for example, to make it go away because it may be particularly unacceptable for our teenage, kids. Joint pain, swelling, redness, commonly is associated with inflammatory bowel disease, and typically if you have any of these symptoms, let your doctor know. It may be one of the signs of inflammation in the gut, and treating inflammation in the gut will help to resolve these symptoms with joint pain, swelling, and redness. One rare inflammation that we see, but it certainly does happen, and literature suggests that about 10% of people with inflammatory bowel disease may develop it, is different kind of inflammation in the eye that may be associated with inflammatory bowel disease. The most common of them is uveitis, which is inflammation in the middle of the eye. It may present with eye pain, with blurry vision, with changes in vision, or redness in the eye, or sometimes unequal pupil. So if you look in the mirror and your pupil is not circular, but has kind of strange edges, that may be associated with this. And if you have any of the symptoms, you really need to see eye doctor sooner than later, because treatment would resolve any inflammation and prevent any sight loss or decrease in visual acuity. I typically suggest people to be screened at the diagnosis with inflammatory bowel disease if they have any symptoms, and then every few years thereafter if there is a concern. Psychosocial health is critical. We see more and more patients who have some form of depression or anxiety or adjustment disorder or social isolation with any chronic illness, but it's particularly common with inflammatory bowel disease. At least a quarter of our patients with inflammatory bowel disease, when properly screened and looked at, may have been depressed or have anxiety or social isolation and have difficulty coping, sometimes missing school. And we definitely have to address it very closely. We do tend to screen people at least yearly for depression and anxiety. We do recommend to avoid all tobacco products because nicotine has been associated with disease flare, in particular with Crohn's disease. I would highly recommend to consider working with support groups through CCFA in particular. They have groups here in Minneapolis for both children and adults. So for parents of children who have Crohn's disease and for children who have Crohn's disease, or when children get older, they can go to the adult group. And that's very helpful for both learning about the disease, in particular when you're new to this, learning whom to call with questions if you don't feel comfortable yet to call your doctor, or you want to just consult somebody else. Maybe somebody went through some similar problem that your child is going through or you're going through, and it's really a helpful way to connect. Camp Oasis is a fantastic opportunity. We all have been working with Camp Oasis as volunteers. In the past, it's a camp for kids with both Crohn's disease and ulcerative colitis. It's absolutely amazing place for kids to connect with others who have similar problem. Some who have more serious presentation of their problem, they develop lifelong friendships and have a group of people they can call and talk about their symptoms outside school, where it typically would not be something they would do on a regular basis. I'm a big fan of teaching my patients progressive muscular relaxation or meditation for the purposes of mental health and dealing with anxiety and depression. There are two great apps that I like. One is Headspace, which is good for adults and kids, and one is Insight Timer that have a variety of different options to choose to learn meditation. It has been shown in multiple studies how this particular approach may be just as helpful as some of the medications we use for anxiety and depression or therapy, because some of the teenagers don't really want to talk to therapists. And it's not very helpful to force them to go to therapists because it's not going to be helpful. It will only help if you actually want to talk and work on your problem. But some of them will be happy to learn meditation or progressive muscular relaxation. If you do it every day, maybe several times a day, depending on what's going on, it certainly will be helpful to address some of the difficulties that you may have related to inflammatory bowel disease. We talk a lot about personalization of medical care, which is not to treat everybody with the same pill and find a treatment way that not only helps treat disease, but find one that will be most effective for this particular patient's disease state, severity, extent, find one that patient responds to. But not we shouldn't only concentrate on that part of the personalization. It's equally important, I think, to concentrate on whether this patient tolerates this medication. There are people in pediatric age group who would be very afraid of shots. And sometimes it's so severe that they cannot do that. And sometimes we can work with child family life support. Sometimes we can talk with psychologists. Sometimes we can use certain medications. Sometimes we can use numbing techniques for skin prior to injection, but sometimes it doesn't work. And even if I think that this injectable medication is the best for treatment of disease, if it's not given to a patient, it's not going to be effective, obviously. So we need to find out what this patient would tolerate. Some other people wouldn't swallow pills, but they would rather have injections. So we have to talk about this and see what actually works for this particular patient, discuss medication, discuss their side effects, but also discuss whether it's something they're willing to do. Some of my teenagers are, in particular boys for some reason, comparing to girls, will be really against taking any rectal medications. So we have to discuss that, because if I prescribe rectal medication to treat their ulcerative colitis, but they're not taking it, it doesn't work as well as if you actually take it. I don't know why, but it's a fact. So we need to find out what you would be willing to take. Side effect medications are important. You know, there are plenty of people who we prescribe methotrexate for Crohn's disease and who actually don't take it when we talk with them later because they have severe fatigue, or they have severe nausea, they have vomiting after taking this medication. And sometimes it's something we can treat and see if we can help them, and sometimes it's so severe or so unacceptable to the patient that we really have to move on. I did have several experiences with the patients where I saw a patient for several years, and they came back and told me that actually medication that I prescribed them for last 2 years have not been taken at all. And so it's very important every visit to address what works, what doesn't work, what are you willing to take, what are you not willing to take. Some of the 5-ASAs, medications we commonly use for ulcerative colitis, such as sulfasalazine and Lialda and others, typically many of them are, Lialda is not one of them, but others are suggested to be taken several times a day. There is no patient that I know that would take chronic medication 3 times a day. It just doesn't exist in my mind. So we typically start with twice a day, or at least I start with twice a day. But it's commonly true that patients will be much more likely to take medication regularly if it's only prescribed once a day. Maybe it's not ideal, but it's better than not taking it at all, or skipping every night dose or every morning dose for that reason. It's also important to address whether this medication is acceptable to the family. There are plenty of families who have certain ideas about certain medications, and even if I prescribe them, they wouldn't administer this medication to their patients, to their children. And so it's important to find what their ideas are, how they would like to be treated when I present a variety of different options. Whether this medication is affordable. I can't tell you how many people I prescribed Entrecort or Uceris for Crohn's or ulcerative colitis who called me later and said it will cost us $3,000 a month to take it. And that's obviously not acceptable, and we need to either communicate with insurance and try to find how to cover it, or find other alternative options for treatment of people. So I think that when I think about personalized medicine, I not only think about which medication will be best to treat this particular patient, but also whether the patient will accept this and whether it will be affordable for the family, and all these other questions that we discussed. So it's important to ask, do you have difficulty remembering taking a medication? Or commonly, how many times in the last week you took your medication? Do you have any concerns about medication itself or risks associated with this medication taking? Do you have any pain with injection and nausea after taking this medication? Can you afford this medication? Are you wondering about alternatives? What can be used otherwise? Should we adjust dose and frequency? For example, there are people who because of severity of their illness, went to every 4 weeks infliximab infusions, but who have been in remission for many years. And perhaps if we check their level of infliximab, it may be actually adequate, and maybe we can discuss going down on frequency to every 5 weeks and every 6 weeks and see how they do. If they tolerate it well and they do well, that's something that we might consider. So speak with us. There are multiple discount pharmacies that I discovered through the years. My favorite one that unfortunately doesn't accept children, as far as I know, is one by, what's his name, Mark Cuban. Yes, that's one, yes. I don't know why they don't accept children, but that's fantastic one. And there are some others that are at least on this IBD kind of resources guideline that I put together through all these years that you might look at. And it's worthwhile to check, because a lot of times people try this discount pharmacy and found that coverage of the medication is significantly better than what they can get through insurance. Many manufacturers, in particular biologics such as Remicade and Humira, do offer major discounts for patients, in particular for families who can't afford it. And it's something that should be looked at. I recommend all the patients, even if they don't, I don't provide it to them because, I can't keep completely up to speed on this, to Google things and find out and talk to manufacturers. Sometimes manufacturer will talk with one particular family and they will offer certain discounts that are not available otherwise. So it's something that's worthwhile to consider. Talk to us whenever you have any concerns, and it's important for us to talk, and it's also important for us to learn from you. So if you do find something interesting and that works for you, or some trick that you learn, please let us know so that we can learn from you and share this information with other families and other patients of ours who may benefit from it. This is an important slide that I give to all my patients, is when to call. So first of all, call anytime you have any concerns or questions. Doesn't matter what symptoms are. Doesn't matter what's going on. Just call us, let us know what's going on. I may tell you, don't worry. I may tell you, go to see your primary care doctor. But it could be something that may trigger further workup or further concerns or further follow-up calls. If there is any fever of 101 for over 48 hours or so, if there is new onset of abdominal pain, if there is pain that wakes you up in the middle of the night, if you have changes in bowel habits, if you wake up at night to go to the bathroom, if you have blood in the stool, obviously rectal pain, vomiting, unexplained rashes, canker sores, joint pains, or if there is a case of chickenpox at school, or if there's exposure to tuberculosis potentially. That's something that we need to know in advance, because we can prevent illness. If you tell us that child is exposed to chickenpox, and I know that child does not have antibodies against chickenpox, we will treat it to prevent the illness. Because if you're immunosuppressed, you may have pretty severe chickenpox, and we don't want this to happen. So if there is any concern whatsoever, please call us. We want to know about this. We want to try to help you. At the end of this, the last slide that I'll show you next has the link to some IBD resources that I pulled together. It includes a variety of different sources to look for information. It includes some college suggestions. It includes discount pharmacies, when to call us, how to do these things. And it's something you might find helpful. Again, share with us any new information you may found that we are not aware about, because we would love to learn about this, not just for ourselves, but we would like to share your experience and good finds with our patients. There are some good resources and publications here. This is a QR code as suggested to consider scanning, and if you cannot connect to this guide, let me know. Hopefully it works. I don't know if it needs to be a little higher. I don't know if the bottom, because here bottom is not cut off. Tell me if it works. Did it work or no? We can try to move it higher. I'll move it higher and let me know. Here you go. Works? All right. Let me try to move it higher like this. All right. Oh, what happened? Okay. It's a little crooked, but it should work. So, at this I want to conclude, and if you guys have any questions, please let me know. Thank you very much.